name is Beth Gerritsen, and I am having a bilateral breast reduction. I've always been uncomfortable with the size of my breasts compared to the rest of my body. I've had neck pain, back pain. I have the divots in my shoulders. The emotions I'm experiencing as I lead up to my surgery are all over the map. I'm looking forward to actually feeling better about my body and feeling better physically with less pain. I feel that having this breast reduction surgery will change my outlook on how I feel about myself in a really positive way. I feel like I'll present myself out into the world as a much more confident person.
What is it about your breasts that you're unhappy with?
Pretty much everything. They are the size mainly. They're just very large, especially in proportion to my frame.
So what cup size do you fit into right now?
I'm currently an H.
And what would you like to be?
Honestly, I would like to be like a B, or even a small C.
So it sounds like what we're looking at is a combination of a breast reduction with a breast lift. Now, a breast reduction and a lift are essentially the same operation. The only difference is in a reduction, not only do we lift the breast, but we make it smaller as well. It was really nice meeting Beth. I'm really excited for her because she has got breasts that are so droopy and are so heavy, creating all of these problems with back, neck, and shoulder pain. It is a privilege to be able to help her to take this next step to getting the body that she really deserves and that she really wants. So she is a 36H cup, and you can see she's quite droopy. The plan basically is to lift everything up, to make it a bit narrower, and to make her a bit smaller. Now you can see she's got little grooves in her shoulders here. This is from the weight of the breast. So we're going to go ahead and get her marked for the surgery. So her breasts are excessively long, and when you lose a lot of weight, the breast can really droop a ton. And so her nipples are way down here. We have them covered up right now, and the plan is to actually move them up here and up here. And then this is going to come together, and we're going to lift her to bring her up like so. Now she's definitely a lot bigger than she wants to be, so I'm going to really take a good amount of tissue off of her to give her a nice shape, bring her down to maybe that C cup range that she wants. She's going to trade it for scars that go around, down, and underneath her breasts. So I'm really excited to do her surgery because I know that she has lost all this weight. She's so excited for the changes that are going to come for her. And we're going to take a lot of skin off of her today. This is not going to be easy. All right, so the first step of this operation is that we cut out most of the excess skin. And we do it by peeling the skin literally off the breast. So yes, I am skinning this part of the breast. Okay, so I've removed most of the skin off of this breast centrally, and this is where the blood supply comes to the actual nipple, which is underneath my hand. So I've gone ahead and I've elevated what are called the flaps. I've lifted all of the skin with enough fat here. This is the central portion of the breast, and I'm going to remove here, and I'm going to liposuction out in this area. The idea is we want to really help to thin this area out. All right, so now I'm liposuctioning the extra fat from her side, and we really want to contour this in nicely for her. I'm also going to cut some of that tissue out. That does extend her scar towards the armpit a bit, but that is the trade-off here when you've got so much extra skin. I'm now in the middle of removing her tissue, and you can see this is some of the tissue I've removed already. And next I'm going to be removing all of this coming down, taking all of this out. And when we do this operation, literally we're taking the entire breast apart and we're putting it back together again. Okay, so as you can see, I've got this side partially done. You can see the big difference between one side to the other. The nipple's going to come out through here, and I'm going to do a little more lipo out through here to bring that in. All right, surgery's all done. Everything went really well. Took a little bit more off on this side than that side. The little wrinkles that you see, all that's going to go away. She does have the scars that go around, down, and underneath on each side. And took out also from her sides liposuction to remove extra skin. Beth's surgery today went really well. I took off about 1 pound of extra skin and extra breast tissue from each breast. So this was a lot. This is going to feel so much lighter for her, And I'm so excited to see how she feels when she comes back in just under a week.
I'm here today for my first post-op appointment, and hopefully I'll be getting my drains removed today. Post-surgery, I'm feeling really good. I'm pleasantly surprised. I have very little pain. The biggest thing I've noticed is how light I feel, and my posture is like completely corrected itself like immediately. So it's a funny feeling, but really a good feeling.
Hi there. How are you doing? Things feeling a little bit lighter?
Oh my gosh, not just a little bit.
Okay, good.
Like a lot bit.
Oh, good.
Yeah, I feel completely different.
So they always start off looking kind of funny. They always start off looking boxy,
Right.
flat on the bottom, and then kind of wide. And what's going to happen as time goes on is you're going to round out through here and you're going to narrow. Shape's going to get so much better as time goes on. So after 1 week post-op, patients typically come back to see us at 3 weeks. At that time, if everything is healing well, we take all their tapes off, we get them started on scar creams, and we get them exercising. So how are you doing? It's been 2 months?
Yeah, I'm doing great.
Good, good. You back to pretty much normal activity?
Yep, I'm back to work, and I'm back to exercise and pretty much my normal daily routine. My breasts are feeling normal, really. I have no pain. They feel great. They feel so much lighter than before.
Great.
And just wonderful.
Great, great. Well, let's take a peek at you, and
Okay.
then we'll go into some instructions, okay?
Okay.
So scars look like they're healing great. You still have some reshaping to go, okay? They always start off a little boxy, and as time goes on, they're going to narrow and they're going to round themselves out. How's your back feeling?
My back feels straighter than it's ever felt before.
Good.
I hit my posture straight up. It feels so light, so much lighter than before, so everything feels so much better.
Oh, I'm so glad. I'm so glad.
I'm feeling so good about my results. I can't even think of a word to describe how happy I am. Just the outcome is better than expected. I couldn't be happier. The one thing I would say now is, I wish I would have done it 10 years sooner. I'm actually looking forward to doing things that I kind of used to dread, such as, shopping, buying bras, buying bathing suits, going to the beach, doing activities that I really would kind of avoid before. So I'm really grateful.